You've heard of the big headline medical problems we can be faced with, but there are a whole host of issues out there that don't always receive the attention they deserve. But if you find yourself dealing with them and the side effects they have on the rest of your life, they're no less important. Take, for example, if you're a parent of a child and that child has mental health concerns. These aren't just problems that can be fixed with a few months of treatment. These are lifelong challenges for someone that you care for. And if you've lost your job or at the very least your health care, finding a way to manage that kind of long-term care can create a lot of pressure, emotional and financial. But there are places that were built to help. Say you're a parent of a young child with mental health problems and you're not covered. Where do you go? What do you do? I'm here at Covenant Community Care's Health Center in Royal Oak to find out firsthand what some of the options are. Covenant Community Care serves over 12,000 patients from all over Southeast Michigan who come to their 3 clinics in Royal Oak and on both Michigan Avenue and Waterman in Detroit when they find themselves unable to pay for healthcare services, including OBGYN and pediatric care. Seeking healthcare when you know you can't afford it is always intimidating, and I wanted to experience for myself what it feels like and what to expect when you walk through those doors looking for help. Cecilia, the real reason why I'm here today is because I wanted to see what a parent in this situation who's newly uninsured, probably newly unemployed, has to go through when they don't know where to go and what to do next. So can you tell me what would be next in the process for me as a mom with a child who has mental health needs and is uninsured?
Okay, we would just need the information of the people applying and the income information, just stating how they're supporting themselves.
And by financial information, you mean proof of income that they asked me for at the desk? So what specific examples?
A check stub, maybe a tax return, W-2 form. If the person is unemployed, they can bring an unemployment statement, or if on food benefits, that statement with the amount they're receiving monthly.
Can you, just for the viewers out there who might be going through something like this, obviously it's something that's really scary, it can be daunting. Can you share with me some of the pressures that a parent going through this might face?
I had a mother. She was a single mother to 2 twin girls. Her girls were sick, so she wanted to bring them in for an appointment, but they didn't have insurance. And she didn't want to put them on a sliding scale because she didn't have the money to make ends meet. She was unemployed. So I still told her to come in to see what she's eligible for. So we applied for Healthy Kids for her, and she was approved. And the girls were able to be seen by the doctor, and she didn't know what services she could get for the girls, and she was very grateful.
Yeah. And they, something like Healthy Kids, which is separate from the full Medicaid, they can get approved for day of.
They can get approved day of. The document will look something like this: the child's name and congratulations, that they appear to be eligible, and they receive coverage for January and February, or the 2 months. And then they'll get a decision letter in the mail within 45 days, just asking additional information, and that'll determine whether they're approved for full Medicaid.
And then if they're not approved, they can still
be seen here, and we can put them on a sliding scale, so that there's options for the patients.
So it's as
simple as coming in.
Okay. And speaking to a wonderful benefits counselor like yourself, filling out a form, and they're good to go.
That's it.
All right. Thank you, Cecilia.
You're welcome. Thank you.
Covenant Community Care is here to serve. The people are most important. Not how you got here, but what do you need and how we can help you along that path to wellness, to quality of life, to fullness of life.
So our patient parents come in here, and some of them are, for one reason or the other, afraid that this is going to be tied with their income, or either if they're getting child supports, they're afraid to apply. We see that a lot, but usually we say, you know what, it's a matter of if you have a Social Security, the kid was born here, you're pretty much qualified, and a lot of people are not aware of it.
I think the best way to approach a professional here is in total honesty, with understanding that they will not be judged, that they will be respected, that what they say will be held in confidence.
Just call. Call call Covenant Community Care, call Beaumont, you know, and we're there. We'll explain to them the process, what they're going to get as far as their visit, and that's the best way to get started, is to make that phone call.
There's a lot of resources out there. Go to Human Services. They also have a lot of information out there. Go to your friends and family. We have a lot of people that have referred their friends and family to our clinic. Don't be afraid.